Okay. Hello, everyone. My name is Alamin Abdelgadir. I'm an associate professor of endocrinology at Mohammed bin Rashid University and a consultant endocrinologist at Dubai Hospital. And today we're here back again with Dr. Buthaina bin Bilela. She is head of non-communicable diseases and mental health in Ministry of Health and Prevention. Dr. Buthaina, welcome to EDEC Studio 2026.
Thank you, Dr. Amin, for this introduction, and it's my pleasure to be with you today.
The pleasure is all ours. Thank you. So, how is the EDEC going? This is the third day. How is it going so far?
It's really interesting, and I can see the side rooms are really full. Mashallah, there is no place, especially the thyroid.
Yeah, I can't agree more.
Yeah.
Because the prevalence of thyroid illness is equally on the rise over the last couple of years.
Especially in the Gulf countries.
Oh, yes, can't agree more. Okay, Dr. Buthaina, our hot topic today is obesity in the United Arab Emirates.
Yes.
And probably UAE is no exemption or exception from the Middle East and North Africa.
Yeah.
So we have lots of data that obesity has been on the rise over the last couple of decades. So just walk us through this, please.
Yes. As you mentioned, Dr. Amin, that obesity is a challenge, and it's a disease that we need to tackle it. And UAE also aligned with the global. It is a burden, it is a challenge, but it's a good thing that in this year we need to announce that UAE had made a little decline in obesity prevalence. It was 27.8 in 2018. And it's declined to 20.4 in the National Health Surveillance of 2025. And this is due to the national preventive effort, which has been aligned with multi-sectoral in all health centers. And this put the UAE among the countries on track to achieve SDG 2030.
That's exciting news.
Yeah.
So between 2018 and 2025, it is more or less 20% reduction?
Yes.
Wow, wonderful. So it's the harvesting time.
Yes.
Oh, that's glad and good news. And so you've managed to flip the graph, because the graph was steadily going upwards.
Yes.
So this is the first time to have it going downwards.
Yes.
Oh, interesting. And what was the efforts behind that? How would you manage to do that?
Yes. As you know, health sector cannot work alone, and Ministry of Health cannot work alone to combat obesity. So we have multi-sectoral health and non-health committee for obesity and diabetes. We put multiple initiatives at the national level so we can unify all the effort. Even the non-health sector, obesity, the target was aligned with all of them. And if you can see non-health sector, they have more initiative at workplaces. They have gyms, they have healthy food, they have many initiatives, walkathons, marathons, and the same in health sectors. We have national campaigns. We have launched the national guideline of obesity, and you were part of it last year, and it was really of a great impact on the health entities. And even it has been included in the insurance, which means that the people can seek the medical help easily through the insurance. And we have now launching the obesity clinic among the health center with the lifestyle changes, and we are trying to implement the green prescription for physical activity. And also there is a lot of measures, the physical measures. As you know, that sugar drink, the taxation has increased from 50 to 100%, depending on the sugar concentration and also on the volume. And we have healthy canteens in the school. We have a Masar project from the Ministry of Health with other health sector for the school student. And we have multiple campaigns and initiatives to come.
Brilliant. So lots of work in progress.
Yes, alhamdulillah.
Excellent. And this has been orchestrated by the Ministry of Health and Prevention.
Yes.
Wow. And congratulations for the launch of the guidelines as well.
Yes, thank you.
It has been an important sidewalk or a pathway for all health providers.
And it was with the effort of all health entities in the country and the society. Yes.
Oh, that's brilliant. So now we have achieved an improvement in obesity prevalence. what is the vision forward? What's your target in the coming 5 to 10 years?
Yes, as you know, the global target is to have halt rise in obesity. It doesn't tackle decreasing, but we have achieved beyond the halt rise. We have decreased the obesity. But the main challenge is now to sustain it, to sustain this challenge, to sustain this reduction in obesity. So we have to unify all the efforts. We have to tackle even to provide healthy environment. So health, education, economic, and even the infrastructure specification all should be aligned together. We have to invest more in the regulation, in the policy, to stop marketing of unhealthy food for the children, and to provide easy access for healthy food, motivate the people to have a healthy lifestyle. We have a policy on healthy lifestyle. We have also an action plan on healthy lifestyle. We are collaborating with other non-health sector now to have a strategy for a healthy lifestyle, to have the green prescription, the nutritional counseling, and even to have more campaigns in the school and workplaces.
Wow, that's interesting. That's a true multidisciplinary approach.
Multi-stakeholders, yes.
Oh, excellent, excellent. And I'm leaving the Masar initiative with my kids, that every time they tell me that this is not allowed in school,
Yes.
so please don't bring it to be part
having
of our
impact on the
lunchbox.
children. Because as you know, even the obesity in children is rising, but with this intervention, there is improvement in childhood obesity.
Oh, well, okay.
Yes.
So this will also be presented soon. to
Yes,
us.
because also we have, at the same time with the National Health Survey, there is Nutritional Health Survey.
Okay.
And this is the first time to be implemented in UAE, and it will have a very rich knowledge and information that will help everybody in all the policies to tackle all type of the NCDs and risk factors.
Brilliant, brilliant. Okay, so you've touched on the reimbursement of obesity management. So would this see the light soon? Because as you all know, as you know definitely, that we're struggling about the process of reimbursement in treating obesity in general. Not necessarily the medical treatment, but the whole pathway, the
Yes.
nutritional therapy, the diabetes educators, if in case of diabetes,
Yes.
and the multidisciplinary approach on in treating obesity.
Now we are focusing on life course approach. We are interventing all our intervention to tackle obesity starting from preconception. Any woman trying to conceive, she needs to be counseled, and then with pregnancy, childhood, adolescent, and then to reinforce it in the adulthood. This guideline was really the entry for all healthcare providers to tackle obesity, and also through the insurance, the reimbursement will be there because body mass index and waist circumference already included, and this will help the people to get the free counseling, to be insured about their counseling. The treatment is almost available everywhere. We are trying now to introduce it into the primary healthcare. We are trying to have more workshop on the guidelines to train and build the capacity of healthcare provider to empower them with the knowledge to be easy to prescribe it according to the criteria, and at the same time to prevent the misuse and the abuse of the medication also.
That's correct. That's correct. So we don't need a quick fix
Yes.
just to fit in a dress or something.
Yeah.
So it has to be clinically indicated.
Clinically, yes,
medical
clinically indicated.
intervention. Brilliant. And you've touched on the childhood obesity.
Yes.
It was a concerning issue over
Yeah.
the last couple of decades. So now with the initiative that you have exerted in the multi-sectoral sort of collaboration, you managed to reduce the prevalence of childhood obesity
Yes.
as well.
The obesity in childhood was one of the national indicators in UAE national agenda since 2016 when they were announced, and it was ending by 2021. So at that time, a national obesity, childhood obesity plan was implemented and also launched with multi-stakeholder, and from there came even the Masar project. It was a transformation project. Transformation project is coming from the Prime Minister office. You have 6 months to achieve a target, and it will be followed by the Prime Minister office. From there it has been sustained and it was supported really. I think you mentioned yesterday how was the jump of the school. Above 80 schools now already involved in Masar. and there was a drop in the prevalence of childhood obesity, but really I don't have the exact number, but it has dropped.
At least it's going downwards.
Yes.
That's
Yes,
very reassuring.
yes.
Excellent.
Because
So-
we need to enrich everybody with the knowledge, even the children. They should have the knowledge what to choose, how to choose the healthy food. Because non-healthy food is available everywhere and is cheaper.
Oh yes.
And also we are working on a specification to stop marketing of unhealthy food for the children, where you see everywhere in the street the multiple layers of sandwiches, and this is really appealing for the kids.
Appealing to everyone.
Yes.
Yeah. Okay, that's brilliant. So now you have achieved the decline level, and we are all a bit reassured that all the multi-sectoral campaigns have exerted the outcome. So, being one of the legislative institutions or offices, how do you see the obesity prevalence in the coming 5 years, let's say? What's your vision? I got the chance to go through multiple initiatives, and almost all of them are ending by 2030, 2031.
Yeah.
So what's your vision until that end point, and what's beyond?
As we mentioned earlier, obesity is still a challenge, and to sustain this prevalence and even decrease it, it's a bigger challenge.
Yeah.
So we need to use our data for the policy makers. So we have to identify what are the risk group who are affected more with obesity, and then to target them and tailor our plans initiative according to these groups. And we should have also, to sustain our prevalence, that we need to enforce the early detection of obesity. All health entities, it should be a must. Any patient entering body mass index and weight circumference should be measured. So early detection of obesity risk factor, and every patient should have also a personalized, tailored management for them. So it differs from one to one. And this should be, as we mentioned, multidisciplinary, nutritional counseling, physical activity. It might need medication treatment. Some of them, they might need even surgical treatment. So it should be approached by all the people. The second thing, that we should move from the reactive to be proactive in the management. A step forward also with the policy, with the healthcare system. And instead of depending on the management or risk factor, we have to think about prevention, to start early. We don't wait for the people to become obese or overweight. We should tackle it earlier than that, so we can sustain our prevalence and decrease it more.
That's wonderful. So prevention is always better
Always
than cure.
there, yes.
That's really brilliant. Dr. Abuthena, it has been very exciting chatting with you in
Thank you.
the terms of obesity in the United Arab Emirates. Looking forward to hear more positive figures in the very near future. Thank you for all the efforts exerted from the multi-sectoral collaboration, and looking forward to see you again here in the EDIC studio, probably 2027.
Sure.
And if you have any conclusion or take-home message to the audience.
I think we should take a bold leadership, coordinated leadership to tackle obesity, and also to fight the stigma against obesity, and also to unify our effort between health sector and non-health sector to have the same target to reduce the obesity and to fight the obesity in UAE and prevent the new generation from being even overweight and even obese.
Oh, that's a strong one. Thank you very much, Dr.
Thank
Abuthena,
you.
for being with
Thank
us.
you.
It's
Thank
been a
you.
pleasure.
Thank you. It's
Thank
my
you.
pleasure. Thank you.